Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can also make use of it. Thank you very much. So we were discussing about the holistic properties in children. Especially we were discussing about fetal intervention of holistic properties, how we can inculcate the holistic properties by intervening in the fetal period. In the last class, we have discussed about the formation of avyakta prakriti or prakriti, which is considered as the endowment. The next manifestation of this endowment is nothing but, or avyakta prakriti is nothing but mahan, which contains the drives, okay, impulsive drives. And after that, the same drives are manifested as ahankara or id. This ahankara or id is of mainly three types. That means these potential genetic drives. So they are basically of three types: may be stabilizing, may be fluctuating, or may be physiological. The same has been referred as either sattvika, rajasika, or tamasika ahankaras. And what we always expect is you should inculcate more and more rajasika ahankaras. You should avoid more and more rajasika ahankara. We have to inculcate more and more what you say tamasika and physiological or sattvika ahankaras. So that is one point of intervention where we can interfere during the fetal period to inculcate more and more holistic properties. So if you are able to establish more and more sattvika and as well as tamasika drives, that means if that drives are more and more produced by the baby, or if these drives are get fulfilled in time, then the chance of developing a stable mind of the baby is more in future. Suppose if the rajasika ahankaras are more, then the chance of having a fluctuating minded baby or disturbed minded baby is, or some other with the learning problems, learning disabilities, or some psychological illness will be more. Okay, so now once this ETH is produced, okay, so we have got the ETH. Once this ETH is produced, now how it is influencing. Now we know that this is a version given by Nelson. In the Nelson, he says that maternal emotional state is directly proportional to the circulating hormonal levels, and it also influences the ETH. This is told in Nelson. Okay, that means mother, for the baby, mother itself is the environment, what we call satmyaja bhava. Okay, so mother itself is the environment for the baby, external environment for the baby, external environment for the growing fetus is a uterus and mother. Okay, so any changes which is occurring in this mother, maybe in the blood of the mother or in the external environment in and around the uterus, definitely will going to change, influence the growing fetus, obvious. So now, therefore, what Ayurveda says is emotions of the partners, because we know that how this maternal hormone level will going to increase. Many times because of angry, many times because of the stress factor or frustration or sometimes anxiousness, okay, or sometimes fearfulness. So these are some of the factors which actually increase these catecholamines in our body, maybe adrenaline or cortisol, etc. So uh, definitely they will have the adverse effects. Sympathetic stimulation, so they will have the adverse effects. So therefore, what Ayurveda clearly says that the emotions of the partners, okay, so it's very important. Emotions of the partners is important, especially uh, premarital, precoital, and as well as preconceptional. What I mean to say is, Ayurveda very clearly says that the married life is only not for the sexual gratification. Ayurveda and Indian philosophy very clearly says that married life is to get a good quality offspring, santanotpatti. Okay, it's not for the simple sexual gratification. So therefore, if you are really planning for the baby, it should be a systematically planned process, and pregnancy should not be an accidental process. Okay, so therefore they says that you have to take in consideration of the psychological status of the partner pre-maritally, pre-conceptionally, and as well as pre-coital. Okay, before coitus, what should be the mental status of the both the partners? That is also well explained. Okay, before marital, pre-marital also, what should be the status of the a partner? That is also well explained. and preconceptional. Okay, this is also well explained. So why? Because all these things will going to affect the Eid of the child. Okay, so desires of the mother, what we say usually after 4 months, the desires of the mother, so they are nothing but the Eid of this growing fetus or embryo, Eid. Okay, so that itself is manifested as desires of the mother. Okay, previously the growing fetus before 4 months or 3 months, the indriyas are not developed properly. Therefore, these Eid or drives or potential drives, so they are not able to get manifest. They are there in the settled form. They are not able to manifest. But later onwards, they will go into manifest, and therefore we have to take care of this particular part. Now, suppose if these desires are not fulfilled properly, okay, so you may have some of the developmental problems like dwarfism, crippling, deaf mutism, very clearly explained in our science, like Vamana, Pangu, and as well as Mukhatva. Okay, that means not fulfilling the desires of the mother may even lead to some of the structural problems along with the psychological problems. Okay, and we are well versed with the Dauhruda Avamanajanya Rogas. Okay, that is not respecting the Eid of the child. Eid refers to the Ahankara. Ahankara refers to that particular drives which are present in the growing fetus, and we know that these drives are illogical, immoral, and there is lack of unity. Only it works on the principle of pain and pleasure principle, and it has to be get fulfilled. That's all. What will be the consequence? That is the next issue. But these drives want to be get fulfilled immediately. Okay. Now, if it is not fulfilled, these are the possible complications. Now, next, what happens after the development of the indriyas? After 3 months, later the Eid of the fetus is extensively expressed and enjoys the drives. Now, before 3 months, there is no indriyas, so manifestation of the Eid will not be there. But after the formation of the indriya, same Eid or drives, impulsive drives, so that will be exhibited through the indriyas, and it looks like the desires of the mother. Actually, it is not the desires of the mother, it is actually the desire of the baby, growing fetus. Okay, so a pregnant woman during the 3rd and 4th month onwards express the special desires of having something, eating something, having something, or looking at something, and we are surprised. Previously, that lady is of that not that nature, but during the pregnancy, suddenly she develops the desires. So it is obvious that it is not the desire of that lady; it is the desire of that growing fetus. Therefore, it has to be fulfilled. If it is not fulfilled, if it is not fulfilled, the fetus will be under stress, not the mother will be under stress. Okay, so fetus will be under stress, fetus is anxious, fetus is angry, fetus is frustrated, and it leads to so many adverse effects to the development of the child. It is obvious that as an adult, if we are not getting the food in proper time, we are also get anxious, we are also get angry, we are also get frustrated. If our sexual desires are not fulfilled properly, we are also get frustrated, anxious, agitations will be there. A similar thing also takes place to the fetus at the earliest part, and that leads to so many psychological problems in future. Now, what do you mean by the Dauruda stage, and what are the desires of the mother as explained in the Ayurveda? So that we will discuss in the next class. Thank you very much.